All right, Dr. Henderson talking about this time what we call a TUIP, or Transurethral Incision of the Prostate, or TUIP. It's a very quick but very effective procedure for smaller prostates. If you look at the AUA guidelines, so the American Urologic Association guidelines, what they recommend when you have a prostate size of 30 grams or less is the most appropriate procedures are probably a TURP or TURP, or the TUIP, TUIP. The nice thing about the TUIP is you're really not changing much, you're just trying to open up the prostate a little bit more. It's probably more effective for a little tight bladder neck or hard to get the camera through if you do a workup in the office with us. All we do is make 2 incisions down at the base. We kind of start near the ureteral openings in the bladder and we cut right through each side with a little bit of cautery. If you have a small little opening, it'll pop that open because you just opened up 2 sides down below. It doesn't really have the side effects of retrograde ejaculation, which sometimes people complain about with the TURP. It doesn't have a ton of bleeding because you're just making little incisions. You're really not disturbing the rest of the tissue. It's more of an effective procedure, probably so for younger men who still want to be fertile and have children. So that's why they kind of developed that, is to open up the area so you can urinate or void a little bit better, but still have normal ejaculation. Everything else is pretty normal with that. It's just not as effective if you have a really obstructing prostate. So again, if you are done having children, I would probably lean more towards the TURP. If you still want to have children, the TUIP is a great option for you as a patient or individual.